The time now is 6:14. Seminole County leaders say they're all prepped and ready to get a big shipment of Moderna's coronavirus vaccine today.
And we've been telling you about this all morning, and now we want to bring in the county's emergency manager, Alan Harris, live to talk about this distribution process. So a lot of pieces here, Alan. You guys are set to get about 8,100 doses later today. Is that even enough to vaccinate everyone you're looking at for this first phase?
It is not. It will help us make a dent, and it certainly is very welcomed. It's like a Christmas gift, if you will, this week, but it is not enough, and we already have requested from the state additional doses.
All right, so as you asked for those additional doses, I think the million-dollar question is, when will the vaccines be ready for the general public?
Sure. So these doses are specifically for individuals that interact with COVID patients, so healthcare workers, non-hospital. So hospitals already dealing with their own. We're doing EMTs, paramedics, public health that are out doing the testing sites, primary care physicians, those types of folks. Our next tier would be other first responders, law enforcement, 911 operators, since they're essential to the first response network. And then the next priority is the 65 and older. So that's the general public that we'll be trying to get to. Also, long-term care long-term care facilities are very, very critical. CVS and Walgreens is in the process of working through the list, but if for some reason it gets slowed down in any way, we are ready to step in to assist with that as well.
And you said even for you all, there's still a lot of questions here, right, about who is going to kind of take that next priority after some of these. We've been hearing a lot from teachers that they want this, but even you all don't know at this point who will be next in line, right?
Right. So we have a general plan from the state of Florida, but we don't know what the next level is going to be. So once we get to 65 and older, is it going to be individuals with immune compromised conditions? We assume that is going to be the case. Is it going to be teachers? Is it going to be people that are in congregate living so that they cannot separate? For example, the jail or drug treatment programs or rehab facilities or senior living, those kind of things, those individuals that are in that type of setting are certainly going to need the vaccine. They can't separate. They can't social distance as easy. So certainly we want to get into there as soon as possible.
And one more real quick, Alan. How do you plan to get as many people as vaccinated as possible?
Sure. So we've been working on this from a long, long time ago when there was threats of anthrax and things like that. We have what we call points of dispensing. So those can be mobile if we go to long-term care facilities, or they can be fixed. For anthrax, we would have been giving out antibiotics. Of course, for COVID, we're giving out the vaccine.
Well, thank you, Alan Harris in Seminole County. Know that you have a lot of logistics work ahead of you, so thank you so much for joining us so early this morning.
Thank you.
I'll certainly keep you guys posted as we hear more about how everybody does plan to distribute the vaccine.
Yeah, big day, really, right, for Central Florida, as Orange County and Seminole County get large amounts of those vaccines today. All right, let's switch to